Oh, look at that. If you don't like that, I absolutely cannot show you anything that will make you happy. That's like the best one I've seen in a long time. Wow, swoon. Any takers? Be bold.
Pinkus?
Pinkus, yes. Fibroepithelioma of Pinkus, which people have argued back and forth over, is it actually a basal cell carcinoma variant, or is it a variant of trichoblastoma, some sort of benign hair follicle tumor? I think there's decent evidence for it being a benign hair follicle tumor, even though I've always been trained to call it a basal cell carcinoma variant, and I believe that's what the current WHO says, because it does have kind of a stroma. It has some myxoid stroma like a basal would have, and sometimes has clefts, but also it can have areas that have the more kind of cellular stroma that hugs the basaloid nest like you'd expect in a trichoblastoma or benign hair follicle tumor. And additionally, some studies have found that you can have a scattered CK20 positive Merkel cell colonizing the lesion, which is a feature I usually think of for benign hair follicle tumors like trichoep or trichoblastoma, not basal cell carcinoma. But you know what I found more and more in practice is that the line sometimes between basal cell carcinoma and hair follicle tumors can be a bit blurry, and probably because basal cell carcinomas probably are hair follicle type tumors. Even though we think of them as epidermal tumors, they really have a lot of features that are akin to hair follicle tumors. And so I think, if I recall, I was on a panel a few years ago, and Phil LeBois was one of the people, and I think he believes, I'll have to double check this, make sure I'm not misquoting him, but I believe that he was one who either published on this or believes that these are probably a variant of a benign hair follicle tumor, of a trichoblastoma. And what he said is that in any case, of the cases he's seen, he's not seen one have aggressive behavior or be associated with like an aggressive, aggressive type basal cell carcinoma. So even if it is a basal cell carcinoma, it seems to be an indolent, non-aggressive form. So I thought that was interesting input from someone who's seen an enormous amount of dermpath, way more than I have. So I did skip right past how do we recognize Pinkus for anyone online watching this and wondering. So Dr. Pinkus was one of the founding fathers of dermatopathology, and so this tumor bears his name. And fibroepithelioma of Pinkus, or I usually will put them as basal cell carcinoma, fibroepithelioma of Pinkus type, and then I add a comment that some people think they're a benign hair follicle tumor, and some people think they're basal. Sometimes I'll add that comment. My views have kind of changed over the years, but what we see is this kind of net-like or fenestrated pattern, and fenestrae means windows, right? So what we have are these elongated, thin branches stretching down from the epidermis in multiple places and interconnecting together, and then you're getting islands of dermis in between, and these islands are kind of like windows, right? This is a lattice work of interconnected strands of epithelial cells with windows kind of in the middle of it, right? And so let's talk about the epithelium. All right, I feel like one thing that helps me with Pinkus, because there are sometimes some other things that can look a little similar, particularly syringofibroadenoma or syringofibroadenomatous epidermal changes can have some of this downward net-like growth, but they're a little different. The texture of the epithelium or the quality of the epithelial cells is different. So what I think of when I think of Pinkus, and this is maybe the color of this is not the best example to show it, but the pattern is so beautiful, is I feel like you get two different looks. You get these strands here, which oftentimes the strands tend to be a little bit more pink. In this case, they're a little bit more blue, but they are kind of like I think this slide was just a little darkly stained, but they look more like keratinocytes, like the epidermis. So you get strands of stuff that looks similar to epidermal keratinocytes, and then coming off of that, you begin to have little buds that look more basaloid and have the really nice, like palisading kind of basal cell carcinoma or trichoblastoma type of look. So I feel like that's the thing that helps me, is that you're getting two things. You're getting the strands of keratinocytes, and then you're getting little buds that look like basal cell carcinoma. And again, this may be the best example I've seen of the stroma really, I mean, strikingly resembling the stroma of a benign hair follicle tumor. It's when you see the cells that are the stromal cells that are getting oval or round and then hugging and clumping up right against the basaloid palisading without any cleft in between. That's exactly the stroma I want to see in a trichoep or a trichoblastoma. And what's happening is that this is basically akin to what you see in papillary mesenchymal bodies, right, which are the kind of classic finding in trichoepithelioma. And look, I mean, those look perfect for papillary mesenchymal bodies, these little round cell areas. If you stained that are kind of trapped in the middle here, if you stain those with keratin, they'll be negative because they're actually stromal cells. I think they'll stain with CD10, actually. The stroma around hair follicles is kind of special and is usually pretty strongly positive for CD10. So, pink strands with blue basaloid islands. And then here's an area that I think probably just represented a little rupture and inflammation, and you're getting kind of a busy desmoplastic kind of area like you would see like in an infiltrative basal. But when you look at the whole tumor, clearly it's not infiltrative, right? So I think this is kind of what's happening right here. You can see in a variety of adnexal tumors and also in basal cells, of course, but you can see this pattern of more pink kind of strands with a background of stroma that's very busy and kind of myxoid and spindly. You can see that in the setting of kind of a inflamed or irritated area in the middle of tricholemomas, what we call desmoplastic tricholemoma. That kind of pattern of basically a reactive change that's mimicking infiltrative basal. You can see that not only in desmoplastic tricholemoma, but you can see it also in a variety of other adnexal things. And sometimes if you don't have the whole lesion, it can really cause a concern for an aggressive malignancy. But that's more of that stranding and then basaloid islands right there. So, fibroepithelioma of Pinkus. And then look, let's see that we do have a little bit of clefting over here. So it's a bit of an enigma, right? It has that stuff right there. You'd think the cleft would support basal cell. So I don't know what the real answer is. And smarter people with me have argued over it and not totally resolved it. So I'll just tell you that there are different views on it, but whatever name we call it, it's quite pretty and it does not seem to cause serious problems for people. So I think it'd be reasonable to either do a conservative management of it or at least watch it, afterwards to make sure it doesn't recur. But I don't think probably aggressive treatment is needed. But that's just my thoughts as of January 2022. Oh, look, wait, one last thing. I'm sorry, I can't help myself. Look at that. What's that pink stuff?
Amyloid.
It's amyloid, and it's keratin amyloid. Anytime the amyloid's like right around an epithelial tumor, be it a basal, be it a seb, be it a Pinkus or trichoblastoma, anything, that is keratin derived from epithelial cells that have dropped out keratin. And one of the clues, it's pink and it's smudgy like just like light chain amyloid would be. It will stain with I don't know, Congo is iffy to me. The books I think say it's positive, but I find Congo hard to interpret sometimes. But thioflavin T beautifully lights this stuff up. You have to have direct immunofluorescence, an immunofluorescence microscope to be able to read it. But it's quite beautiful, turns bright green. So the thing to me is that it looks like amyloid, but it's right next to the epithelial stuff trapped around the tumor, or in the case of macular amyloid or lichen amyloid, it's in the papillary dermis. And then also in the cracks, it often has pigment. And that's because as the epithelial cells break down and smash together, it's kind of almost like cytoid bodies that are getting all packed together. That's the way I kind of think of it. And as that process happens, the melanin pigment that was contained in those cells, because look, basal cells and sebs and sometimes trichoblastomas and trichoeps, they often have pigment in them, melanin pigment from kind of passenger melanocytes that are colonizing them. So that pigment drops out too, and the pigment gets trapped up in between the pink. So pink amyloid that has melanin, brown melanin pigment in the crack spaces, and that the amyloid is right next to epithelium. Usually that's going to be keratin-derived amyloid, which is totally unrelated to light chains or myeloma or systemic, amyloidosis or any of that. So that's important. So when I see that, I actually just point it out to the residents, and then I don't even mention it in my report, because otherwise it's going to cause angst to someone who may not know and sees the word amyloid. And amyloidosis, systemic amyloidosis, is a very serious, condition. So that's important to know that keratin amyloids are unrelated to those. Beautiful example. Wow. I can't do any more work today. I need to go home now. It's just too awesome.